The outbreak of COVID-19 in northern Saskatchewan continues, and about 25% of people eligible to get vaccinated in our province still don't have their first dose. We know the Saskatchewan Health Authority is shifting its focus from drive-thrus and mass vaccinations to walk-in clinics all over the place, stores, parks, summer events. But if that doesn't boost vaccination rates, then what? Dr. Anand Kumar is a professor of medical microbiology at the University of Manitoba and an intensive care physician. Thanks for being here, Dr. Kumar.
My pleasure.
First off, I'm curious what you think of the news that some prairie provinces, currently here in Saskatchewan and coming soon in Alberta, there will no longer be a legal requirement for people to isolate if they test positive for COVID-19.
I think it's a gamble. I think our politicians want to be done with COVID, but unfortunately, I don't think COVID's done with us. There is some significant potential for problems going forward. Still, it's not going to be a smooth road.
What message do you think it sends to people who have yet to be vaccinated?
I think it decreases the urgency for vaccination quite frankly. If you think this thing is over, then the impetus to get vaccinated drops quite a bit. Unfortunately, I think people don't realize with where it looks like we're going to plateau with vaccination rates. Basically, this will turn into a what we call an endemic infection. That is one that just circulates all the time in the population. And what that means effectively is that within the next 3 to 5 years, you are either going to be vaccinated or you're going to get COVID, all of us. So, I think it's a mistake to take this to, not seriously enough.
We are rapidly approaching August, and with that, people do start thinking about back to school. Based on what you see happening now, what do you think will happen with COVID-19 this fall? Are we looking at a fourth wave?
Yeah, absolutely. I don't think there's any question that we're going to see a fourth wave. What's going to happen between now and the end of August is the numbers are going to continue to rise more and more rapidly. But once school starts, where you have all those kids that are under the age of 12 and are completely unvaccinated, and of course, those that are 12 to 20 are among the least vaccinated groups, you're going to see it spreading, I think, quite rapidly in schools. Children are going to get ill a lot more than we've seen in the past. The previous COVID variants were not nearly as infectious, not nearly as transmissible as Delta variant is. And so all the data that we have in the past that schools were not highly involved in transmission, that's all out the window. This is a new infection. So based on what we're seeing in England and other countries, we're going to see significant transmission in the schools. A decent number of children, sadly, are going to become ill, and some critically ill. The other group that's going to be heavily involved, of course, are the unvaccinated. Although Delta can certainly infect even those who are fully vaccinated, it's going to hit the hardest those who are unvaccinated. And those are the ones we're going to see in the ICU. Even today, virtually everybody that we see in the adult ICU is either unvaccinated or partially vaccinated. Fully vaccinated people in the ICU from COVID is virtually not seen.
What advice, before I let you go, do you have for parents who are really scared or concerned about sending their kids back to school in September, even just based on what you just said?
Well, I have a colleague of mine, Jillian Horton, who has kids of that age, and she's quite worried about it. My advice would be to lobby the schools and the government to improve ventilation and air exchange in the schools. They should mask and they should socially distance, just as we've been doing. For my own money, I think that we should have mandatory vaccination for those children who are eligible for vaccination as well. I don't know that I've seen that discussed, but I think that would be a really wise thing. And I just pray that young kids who are currently not eligible will be eligible in the near future. And then we need to have a really hard push on getting them all vaccinated.
Thanks so much for your time, Dr. Kumar.
My pleasure.